Has it ever occurred to you that your hands and feet seem colder than usual, particularly at night? Have you ever climbed just a few stairs only to find your heart racing, your breath shortening, and your legs threatening to give way? Many mistakenly attribute such symptoms to the natural process of aging. However, it is imperative to recognize that these could be early indications of a more severe health issue, poor blood circulation. The most concerning aspect of this condition is its gradual onset. It causes little in the way of acute pain or dramatic incidents, yet it incrementally depletes your vitality, resulting in fatigue, aches, nerve impairment, and, in severe cases, even stroke. According to the American Heart Association, poor circulation constitutes a leading risk factor for heart failure, tissue necrosis, and limb loss in older adults. Alarmingly, the majority remain unaware of their condition until irreparable harm has already occurred. The encouraging news is that there are means to counteract and reverse this slow decline. Through appropriate measures, one may regain leg strength, enhance memory, reduce fatigue, and promote daily well-being. This discussion will examine the concealed causes underlying compromised circulation, the critical symptoms that warrant your vigilance, the profound complications that can arise if detection is delayed, and the significance of early medical assessment. Remain attentive, as you may find the 7th point particularly unexpected. Should you have concerns regarding your health, or if you are already experiencing numbness, cramps, or unexplained discomfort, it is advised to follow this guidance closely. Each step will be elucidated thoroughly and sensibly so that you may pursue a robust physique, mental clarity, and a life unhampered by persistent apprehension. Blood circulation functions as the body's essential transport network, supplying oxygen, nutrients, hormones, and immune agents to sustain the brain, heart, muscles, bones, and skin. Should this flow be obstructed, slowed, or uneven, your health inevitably deteriorates, often without immediate awareness. Numerous factors, especially prevalent among those over 60, can diminish circulation. The most concerning and commonly encountered causes are as follows. 1. Cardiac issues. When the heart fatigues, blood flow is compromised, as the heart acts as the circulation's central pump. In its optimal state, it propels blood energetically throughout the body. If weakened, as in cases of heart failure, the muscle's contraction is inadequate, thus starving the organs. This can manifest as chronic tiredness, chest constriction, leg swelling, and breathlessness in recumbency. Coronary artery disease similarly narrows the vessels supplying the heart via cholesterol plaques, heightening heart attack risk and impeding overall circulation. Lesser known yet also significant are irregular heart rhythms, arrhythmias, which produce erratic cardiac output and result in dizziness, rapid or irregular pulses, and cold extremities. Research from Harvard University indicates that even mild arrhythmias may restrict blood supply to the brain and limbs, elevating the likelihood of falls and cognitive confusion among the elderly. 2. Compressed or obstructed blood vessels. Even with a healthy heart, narrowed or compromised vessels can curtail blood flow. Atherosclerosis, wherein arteries progressively constrict due to cholesterol, calcium, and inflammatory plaques, is the most frequent culprit. Over time, this restricts blood supply to the limbs, brain, and heart, manifesting most conspicuously as peripheral artery disease, PAD, in the legs. Typical symptoms include calf pain during ambulation, slow healing wounds, ulcers, and in advanced instances, tissue death. Deep vein thrombosis is another risk where a large clot may break free and travel to the lungs, causing a potentially fatal pulmonary embolism. Varicose veins, which are often mistakenly dismissed as merely cosmetic, can also impede blood return, causing leg pain, swelling, and a heightened risk of clot formation. 3. Blood disorders. The intrinsic quality of the blood significantly influences circulation. Raised levels of harmful cholesterol are predisposed to adhering to artery walls, exacerbating blockages, and raising the specter of heart attack or stroke. Iron deficiency is equally critical. Iron is vital for the hemoglobin in red blood cells that ferries oxygen. Insufficiency leads to anemia, characterized by lethargy, pallid complexion, chilliness in the extremities, headaches, and dizziness. And studies in the American Journal of Clinical Nutrition highlight iron deficiency as a prevalent cause of poor oxygen delivery in older adults' muscles. Additionally, individuals with diabetes are particularly at risk, as persistently elevated blood sugar damages vessel walls, narrows arteries, impedes wound healing, and in the feet can convert minor lesions into severe ulcers demanding amputation. 4. Unstable blood pressure. Both high and low blood pressure are hazardous to vessel integrity and effective perfusion. Hypertension stresses vessel walls, rendering them inflexible, fragile, or otherwise impaired, consequently undermining their blood-carrying capacity. Notoriously asymptomatic, hypertension is hence dubbed the silent killer. Conversely, hypotension can also be perilous. The resultant feeble force cannot adequately deliver blood to peripheral parts, leading to dizziness, nausea, cold extremities, and sometimes unconsciousness. Chronic blood flow disruption starves vital organs of oxygen, manifesting in the elderly as sustained exhaustion, waning memory, and reduced mobility. 5. Sedentary habits. Inactivity constitutes a significant risk for poor circulation. Extended periods of sitting, avoidance of exercise due to joint pain, or waning motivation contribute to the decline. Muscles, when immobile, do not contract. Veins are insufficiently stimulated, and the heart fails to efficiently receive blood return, leading to congestion, swelling, heavy legs, and increased clot risk. Even a brief period of reduced movement drastically diminishes muscular blood supply, resulting in atrophy, limb weakness, and heightened probability of falling. Poor circulation is insidious, its symptoms often mistaken for ordinary fatigue or natural aging, which delays recognition and timely intervention. Yet, careful self-observation may yield early detection. Prominent signs include 1. Cold extremities, persistent chilliness in hands or feet, unrelated to the environment, suggests inadequate blood flow to peripheral limbs. Blood regulates temperature, and its absence leads to the sensation of icy fingers and toes, or chills in the calves or forearms, even when the rest of the body feels normal. Many explain this away as weather-related, a result of immobility, or a mere function of age, ignoring the declining circulatory health. 2. Tingling or pins and needles. Prickling sensations or numbness in the fingers or toes can occur when nerves are deprived of adequate oxygen and nutrients due to reduced blood flow. This interrupts nerve function, manifesting as tingling, numbness, or a temporary loss of sensation, an early sign of peripheral nerve impairment, particularly in those with diabetes or hypertension, let's say. 3. Dry, flaky skin and hair loss on legs. Neglected by sufficient nourishment, the skin on your legs may become dry, rough, or inelastic, and the hair may gradually thin or fall out inexplicably. Skin and hair follicles similarly depend on nourishing blood for vitality. Insufficient circulation yields dryness, pruritus, cracks, and alopecia. Of particular concern are small wounds on the legs that heal slowly, as compromised blood flow prevents delivery of immune and reparative elements, predisposing to infection. 4. Brittle nails, fingernails, and toenails, being the most distant from the heart, are quick to display decline in blood supply. Poor circulation causes nails to thin, become brittle, split, or discolor, which, though often overlooked, can be an accessible signal of systemic vascular compromise. Leg pain upon walking. Should short walks result in sore, heavy, or tired legs, necessitating frequent pauses? This may not be due solely to muscles or joints. Such pain, relieved by rest and called intermittent claudication, often results from a shortage of blood to the legs due to narrowed or blocked vessels as lower limb ischemia or PAD. Untreated, this may progress to ulceration, necrosis, or even amputation. 6. Swelling of legs and ankles. Swelling in the ankles or feet, particularly after standing or in the afternoon, may initially produce mild discomfort, but over time signals blood pooling in the lower extremities due to faulty venous return. Such swelling is an early warning of venous insufficiency or underlying heart failure. 7. Erectile dysfunction in men. Circulation does not only nourish the heart, legs, or skin, it is essential for sexual function. Erectile dysfunction in males may be an early indication of inadequate blood supply and is not merely a function of aging. Studies demonstrate that men experiencing this symptom stand at a markedly increased risk of cardiac events or a stroke in the subsequent decade, and ignoring poor circulation can result in dire outcomes far beyond fatigue or occasional numbness. Neglect may culminate silently but fatally, affecting the entire body and jeopardizing life itself. 1. Permanent nerve damage. Nerves require continuous delivery of oxygen-rich blood. Impaired circulation deprives them of nourishment, potentially leading to progressive loss of sensation, peripheral neuropathy. This may begin as tingling, but can advance to total loss of feeling, raising the risk of unnoticed injuries, falls, and ultimately the inability to maintain independence. 2. Tissue necrosis. Tissues bereft of blood supply suffocate and die. Necrosis classically starts at the body's periphery, toes, heels, fingertips, characterized by dark discoloration and severe pain, followed by gradual spread. Surgical removal may become essential. This is common among older individuals with diabetes, PAD, or congestive heart failure, wherein minor wounds deteriorate swiftly. 3. Diabetic foot ulcers. For diabetics, impaired blood vessels hinder healing in the most distant tissues. Seemingly trivial blisters can deteriorate into chronic ulcers, become infected, and may ultimately necessitate limb amputation. The World Health Organization notes that every 20 seconds, a limb is lost globally to diabetic complications, over 4/5 originating as treatable ulcers. 4. peripheral artery disease. PAD, arising from narrowing of the leg arteries, restricts life's routine mobility. Sufferers must often pause during even short strolls due to pain. Unmanaged, the condition persists toward tissue loss, infections, and the specter of amputation, whilst also tripling the risk of heart attack or stroke, as atherosclerosis typically affects arteries throughout the body simultaneously. 5. Blood clots and pulmonary embolism. Clots forming in veins or arteries can abruptly disrupt blood flow. If a clot travels from the leg to the lungs, a pulmonary embolism may ensue, a life-threatening emergency that can prove fatal within minutes. Its abrupt onset, presenting as breathlessness, chest pain, rapid heartbeat, cough, or collapse, underscores the importance of regular movement and vigilance regarding new leg swelling. Unfortunately, numerous elderly individuals delay or avoid seeking medical attention, often dismissing symptoms as inevitable aspects of old age. Yet, as outlined above, poor circulation does not constitute a trivial inconvenience. Without prompt assessment, you risk losing mobility or encountering catastrophic events, such as stroke or limb loss. Early medical evaluation provides several advantages. 1. Identification of underlying causes. Superficial treatments, such as painkillers or topical ointments, generally mask symptoms without addressing the true issue. Only through comprehensive clinical investigation can one determine whether the heart, blood vessels, hemoglobin levels, or blood sugar are at fault. Each cause necessitates a distinct therapeutic approach, and delayed recognition exacerbates the underlying condition. 2. Simple diagnostics to protect your limbs. Blood circulation can be assessed simply and non-invasively. Doppler ultrasound employs a handheld probe to map blood flow velocity and direction in the extremities or neck, detecting blockages or leaks. The ankle brachial index, ABI, compares ankle and arm blood pressures to diagnose PAD. All tests are painless, promptly performed, and invaluable for safeguarding long-term health. 3. Early intervention is most effective and economical. Timely detection of poor circulation facilitates correction through dietary improvement, exercise, and suitable supplementation before severe damage occurs. At advanced stages, pharmaceuticals, operations, or even amputation may be required. Early action not only preserves health, but also curtails costs, mitigates familial burden, and sustains personal independence. It is critical not to delay action until a significant harm arises. Poor circulation, akin to a river ebbing toward dryness, may be reversed by early intervention, but becomes irreversible once the damage is done. Listen to the initial signs: chronic chilliness, persistent pain, or swelling, wounds healing slowly, and consult a clinician promptly. These are not merely hallmarks of aging, but a call for attention and care. Moreover, it is important to understand that age alone need not preclude positive change. Improvement is always attainable with timely commitment. Attend regular checkups, seek medical advice if legs routinely ache, feel cold or numb, and communicate your concerns with loved ones if you sense declining health. Each step taken today is an investment in your future well-being, protecting your heart, limbs, and cognitive capacities for years to come. Should you wonder about specific foods, vitamins, or simple home-based measures to enhance circulation, just rest assured that options are available. The following installment will cover optimal vitamins and supplements to assist in improving circulation, increasing vigor, and lessening symptoms such as cold, limbs numbness, and cramps. Remain attentive for the subsequent part of this informative series. Your health, peace of mind, and capacity to direct your own well-being are of utmost importance.